Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are talking about itching. It's that tingling or often irritating feeling on your skin that makes you want to break out your back scratcher or find someone with some long nails to relieve the itch. Here to tell us all about the itch and the many causes and treatments is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in. So this is an unusual topic, but you know, everybody gets it from time to time. So what are the most common causes of itching?
Okay, well, it is very common. Everybody's itched in their life at some point or other. So the causes are environmental, something touching your skin that's irritating to your skin, insect bites, such as mosquito bites, spiders, lice, right? And then internal causes, such as thyroid problems, diabetes, problems with jaundice, liver problems, and certain medication that you might eat that might make you feel itchy. And for some people, even the sun will make them itchy.
Wow.
Yeah. And then there's the mental component, because as soon as you start scratching, you start getting into what's called an itch-scratch cycle, where you're itchy, you start scratching, that makes you more itchy, you start scratching, and it goes around and around. And you'll see that with people with infections, for example, chicken pox, kids scratching like crazy, getting into an itch-scratch cycle, or people that have got an itch for some reason, let's say, again, a chemical that's irritated them, and they just start digging at themselves. So there's a very strong psychological component, and just thinking of the word lice usually makes people do this.
You know, you see bugs crawling and then you kind of get itchy. All right, so can constant itching mean something that's maybe more serious? If you, you know, it's more than it's just a you know, quick itch.
In fact, one of the sort of ominous signs of a health problem in an elderly person is itch. Suddenly their body will start to get very itchy, and it can mean that they have a malignancy or a cancer inside. Oh. So that is one of the sort of things that we think about with an elderly person who's very itchy. But oftentimes it is something internal, and again, diabetes is so common on this island. It's a common reason for itch. In other internal health problems, again, the thyroid and diabetes, yeah.
And it can be something even as simple as dry skin or irritants. So let's talk about some of the outside things. I was reading up that even the detergent that you can use, you know, or a wool sweater or something can make you really itchy.
There's a couple of things there. Our skin needs to have a natural barrier, and that barrier is an oil barrier. It's a moisture lock-in that happens because our own skin will make oils. And if you strip those oils off with either really hot showers, hot water, or chemicals, meaning the soaps and detergents that you're using, then your skin will not have that natural moisture barrier, and it will be open to other chemicals to getting in, and it'll start to crack and become very dry. And that's a common cause of eczema in Guam. And as far as other chemical soaps, sometimes they're very acidic, and we want an alkaline soap. So certain soaps, like I can name Zest, Irish Spring, these are very acidic soaps, and they will strip off your natural alkaline surface and create an environment where you become very dry and itchy.
So what kind of soaps would you recommend that have alkaline, you said?
They're alkaline, yeah, and they're sort of called synthetic soaps. Like a common brand is Olay, Liquid Dove, Cetaphil, Vanicream. These are not expensive. You can buy them over the counter, but they're much more gentle than the other harsh soaps.
Okay, so you were also talking about some of the more serious things that, you know, it can be a sign, itching can be a sign of, you said diabetes and other things.
Right.
So how can someone know, okay, maybe this isn't normal, when do I need to go see a doctor to see if it's something that's abnormal?
And that's a great question. So first of all, think dry skin and chemicals. And I would say that in my practice, I'm sure 75% of people that come with itch, it's due to dry skin and chemicals. So we tell them to start using very mild soaps. Make sure you moisturize right after you come out of the shower. That's so important, because then you're already moist and you're locking in that wetness by using a nice moisturizer. You could use Eucerin, you could use Vaseline, coconut oil, great. All of that will lock in that water into your skin, so you'll be hydrated, and you won't be using any harsh soaps. And then for detergents, I think my top offender is Gain detergent, and right after that we have Cheer and some of these other very strong detergents with a strong smell that will linger on your skin and cause irritation and itch, especially for children.
Okay, and so do you
And
recommend a different,
So
I know for babies I think it's draft.
Yeah. But just the hypoallergenic, fragrance-free. You don't need organic, you don't need expensive, you just need something that says fragrance-free. And if you're very, very, very sensitive, then just double rinse, put an extra rinse cycle on your washing machine.
Okay, good to know. One last question before we throw to break is, let's talk a little bit about cortisone treatment, and does it work?
It does work. So cortisone, that's a steroid medication, and what is it doing? It is calming down the immune system response. So when we're itchy, what happens is that our little cells are releasing a chemical called histamine. That's why you hear the word antihistamine, like Benadryl. When you are itchy, you can take some Benadryl by mouth and it'll calm it down. But anyway, so your skin is releasing this irritating chemical called histamine by using a steroid medication like hydrocortisone or cortisone that you can buy over the counter. You will calm that immune system reaction down. Except if you keep having the irritant, like the mosquitoes or the insects or the chemicals, it's going to keep getting stronger and stronger. So you need to take the trigger away. And that's often easily done.
Okay, sounds good. Well, we will pick up our discussion on itching when Healthy Living returns. Stay with us.